Hello, everyone. Welcome. I'm Angelique Montano Breslin from the Pelvic Health Hub. And today I have the pleasure of speaking to Kate Roddy, who is a physiotherapist and creator of the KR Curve. So welcome, Kate. Thank you so much
Hi,
for joining me.
thank you. Thanks so much for having me. This is great. I love doing these. So it's so good to be part of the Pelvic Hub.
Yeah, thank you. So maybe before we get started on chatting about the product, maybe you can just tell us a little bit about yourself and what you do.
Perfect. So I've been a physio for about 15, 16 years now. I primarily do sports. But then after the birth of my two children, I hadn't actually heard about pelvic physio when I had my kids. Being in the industry for as long as I have, another colleague gave a presentation on pelvic floor physio, and I was like, we do this? That's amazing. Wow.
Yeah.
Of course, it didn't benefit me because I'd already had my children, but I got into pelvic after that point because I did find it very interesting and intriguing. So I got all my certifications, and I've been doing pelvic now for a couple of years. And when I got into it, I really fell in love with it. I'm now all in, so to speak, on pelvic. And I created a pelvic floor wand because I had been told throughout my pregnancies, both of them, that I should do perineal massage. And I remember looking at diagrams, and I remember looking at the books, and other people had been like, oh, you just do this. And I was like, I can't reach down there. So I sort of thought we need to make it a little bit easier. Pelvic floor wands exist, but none of them really were marketing or doing what I thought they could do to make perineal massage easier for pregnant women. And that was really the goal. And then I created it.
Yeah. So your one was specifically geared towards perineal massage.
Yeah.
Okay.
Yeah.
So for people that don't even know what a wand is, and I don't have one here with me. I don't know if you have one there.
And you would think that I would have brought something like that to an interview like this, Angelique. That would have been quite smart of me. And I think it's always funny because people, they're like, don't you just carry it on you?
It's a pretty heavy piece. So
Yeah, yeah. So, but there's going to be pictures, and I know you're going to tag everything, and people can go take a look at the website after. But
absolutely.
it's basically, if you think about, it's an S-shaped internal. Um, Basically, sometimes I say dildo because I mean people can sort of visualize that a little bit more.
Yeah.
It's casted out of surgical grade stainless steel. There's a reason why we chose that material, and that it has amazing thermal effects. So people respond really nicely to heat or cold sometimes, and especially when we're trying to get those areas to relax. Heat can be really soothing for that reason. But then also in postpartum, when everything is a little bit angry and irritated, um, you can cool it off, and cooling it off can feel quite soothing, but it actually can also help with getting those muscles to contract, because when you put something cold on a muscle, it instinctively wants to
Yeah.
contract. And
I
so that cold
got that.
sensation can create sometimes a reflexive contraction for women, which is really great because our mind and body sometimes need that recircuiting or reconnection after birth, when it's all sort of like, we don't want to do anything.
Yeah, no, that's awesome. I didn't even think about that piece, but it's true. It's almost like a facilitation of an
Yeah.
activation of your pelvic floor.
Yeah. Because I had been telling women to freeze a tampon. I was like, wet a tampon and
Yeah.
put it in the freezer, and then insert that and see if you get that clench effect. And it's not to create this sort of I'm going to use a physio term, like tetany. I don't want that. Okay.
Right.
So that contraction that just holds, but it's just to sort of like get the muscles going again. So
Wake them up, right?
mhm.
Wake them up. Okay, so this particular one is made out of stainless steel, you said, right?
Yeah.
And that's what I find so fascinating with this wand because there are a lot of wands in the market, or not a
Mhm.
lot, but a few.
Yeah.
Different types of materials: plastic, lucite, silicone, all of those.
Yeah.
But stainless steel is a little different. I mentioned earlier, there's some weight to it. So can you
Yeah.
just add a little bit about that and how that can be beneficial?
Yeah, for sure. So so we used it for the thermal effects. We also used it for the sterilization effect because I know that women, especially in those last months, like just inserting anything is sometimes a little bit. So having the ability to sterilize it is great. The weight of it, it is 100% surgical grade stainless steel. We didn't choose a cheaper metal and then coat it, right? There's a reason for safety that we chose it 100%. But with that 100% is, you're right, it is quite heavy. That is most of the time women pick it up and go, oh my God,
Yeah.
right? And so it's a little bit daunting when you first hold on to it. But what that does is it makes it really easy to use with your wrist, right? When something's a little bit lighter, like the plastic, the lucite, all of those, you got to use your own sort of wrist and your forearm muscles
Yeah.
have to give a little bit more to create your own leverage. With the weight of the Kegel release curve, really easy to finesse that pressure, right? Very little pressure through your wrist has to happen for you to hit some of the points and sort of that stretch that you can get around your perineum. And the way it's shaped, really one end, it is double-ended. So there's a smaller end, there's a larger end, but both end up as handles and it's really nice to use. So
And you can use either end, whether you decide to use
yeah,
or
yeah, we recommend using the smaller end to get going. And then the larger end looks a little bit daunting, but if you watch our videos, I use a dilation wheel to show that you get to 10 centimeters and the larger end of our wand is nowhere close to 10 centimeters.
Right.
So I also make the joke that the larger end is probably the diameter that got you into this whole pregnancy dilemma. So
Yeah, yeah. All right. No, that's awesome. That's a great explanation. And I'm just going to grab my model behind me just to,
please.
to show what we're talking about as far as perineal massage or perineal
Perfect.
stretching, right? Obviously, baby's coming out of this area, and we're talking about really stretching in and around here, right?
Yeah.
And to get that tissue moving and prepared for delivery.
Hmm.
So we know for sure that it's beneficial for postpartum as well as prenatally to prepare the tissues for
Hmm.
birth. Can you tell us a little bit more about other, individuals or populations that might benefit from using the KR curve?
Absolutely. So even in the postpartum population, we have the tendency, those muscles have gone through trauma, right? As beautiful as birth is, it is still a trauma to the muscles, just as much as running a marathon can feel amazing when you get to the finish line. 3 days later, your muscles are like, holy hell, those 42 kilometers did a number on us.
Yeah.
And that actually is a trauma to your leg muscles. And so you can kind of parallel it like that. So
Mhm.
those muscles go into some protective guarding. So protective guarding we call overactivity or hypertonicity. And so I recommend it even for getting back in the saddle for postpartum sex. So having something inserted and you be in control of what the first thing is that is inserted is really a lot easier because you're in control rather than your partner kind of poking around down there and not really knowing what
Yeah.
to do and what pressure or level of penetration that you're up for. So you can use it in terms of that. I also say there are people who are right now, we're seeing a lot of cases of people with urge incontinence because the level of stress during this pandemic has been above and beyond what we were all capable of handling. And stress manifests itself in multiple different muscle groups in the body. We often associate it with like holding stress in your jaw, holding stress in your shoulders. But the place that people don't understand is where it's down below too, right? It's central nervous system controlled, and that means our pelvic floor.
Mhm.
So I've been even advocating people to use it on a more of a weekly basis as like a TLC massage. We're not trying to stretch muscles out. But we do know that massage helps with blood flow, and getting blood flow into any muscle is an amazing thing, right? So we weren't really taught to massage down there. We have really stigmatized the vagina to only have one sexual function.
Mhm.
We know that there's four other really important functions, and blood flow and contracting, and stabilizing, supporting, all of these are roles that the rest of our body does. And we give the rest of our body a lot more TLC than we ever would down there. So that was the other reason why I used the material that we used, is because like it's super pretty. It's like the Tiffany's of pelvic floor wands.
Yeah, it's
And if that makes it less of a medical condition, because
Mhm.
you don't need a medical condition to use this or to look after your vagina.
Yeah.
You don't start using a toothbrush before you have it, or after you have a cavity. You use it before. So some of those, and then with the help of a pelvic floor therapist, if there are trigger points, so some of our runners with sort of very tight hip rotators. There's one in particular, Angelique, you know about it. Some others don't. Obturator internus. There's a couple of deeper muscles, but we don't recommend the use of our wand until you've seen a pelvic floor therapist, who then can go through where you're really trying to hit. But it is also designed to hit some of the deeper internal trigger points.
Yeah, absolutely. Okay. And I also find that, I mean, generally athletes, a lot of athletes will tend to have like a tighter pelvic floor, but
Right.
bigger like dancers, gymnasts,
Yeah,
and sometimes, the presentation is not necessarily pain in the vagina per se. I mean, sometimes it is pain with penetration, pain with
of
intercourse.
course.
Sometimes it's just pain in the hips or the deep buttocks or
Yeah.
the low back. But again, it's all sort of stemming from increased excessive tension in the pelvic
Mhm.
floor. So
Yeah.
it's another thing that a lot of individuals are not aware of, right? I mean,
Yeah.
you can
When we
have,
tell,
yeah.
yeah, like when you tell people about stress in their pelvic floor, in their vagina, they're kind of like, are you serious?
We have
Like,
tension everywhere else in our muscles and the body, so why
right.
wouldn't it be there too, right?
Right, absolutely. I mean, like on a very personal level, my sister decided after a couple of things she had a hysterectomy. And you take away a part of our anatomy that's in there, that's still going to disrupt and change the pelvic floor. How the pelvic floor responded to that surgical removal, even though it was laparoscopic,
Right.
it's still a disruption to the area. And anytime anywhere in our body gets disrupted,
Yeah.
we're going to have a reaction to that. And so a lot of the time, our reactions are to protectively guard. And so, she called me and was like, I need a pelvic floor rehab program. And I was like, we live 3,000 miles away.
Really.
It's not that easy, girl. But oncological surgeries,
Yeah.
pelvic floor responds, pelvic fractures, those are not as common. But another common one that we both know about is like falling on the tailbone,
Oh, yeah.
right? How many times do we ask our patient at the end, like, just by chance, like, have you fallen on your tailbone or any, like, fall? And they're like, actually this winter I slipped on ice. And you're like, ding 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 ding.
Don't tell me about it. I've done that a couple times myself. So
Yeah, exactly. And just for
yeah.
people to know, like, almost every muscle in our pelvic floor attaches to our tailbone. So when you disrupt your tailbone, those muscles are like, boom.
Yeah. Here's our pelvic floor. All of
Yep,
it. Here's the tail.
all of it right there.
Yeah. No, I totally agree. Totally agree. I see it all the time in clinic too. People
Hmm.
falling, figure skating, falls on the butt or
Yeah.
even horseback riding, just like
Yep.
the pounding and the
Yep.
squeezing the thighs and just
Totally.
like this whole like tension
Yeah.
in the area. So
Yeah.
uh,
We're
okay.
from Canada for anyone not watching. So we do the winter stuff. Like, we're like, oh yeah, slip on ice, snowboarding. Yep. Got it.
All of those things, right?
Yeah.
Slip and fall on your butt. Okay, is there any reason why somebody would not use a KR curve?
So, I would say no, but it's only because I always say that it's also a preventative care. So one of our do nots is that we did not design this. There are pelvic floor wands that are designed for rectal use, which is not, people don't recognize that we also do internals rectally. There's two ways to hit our pelvic floor. One is through the vagina, others is through rectal. It was not designed for rectal. Okay. The one end is a little bit wider than some of the other pelvic floor wands on the market that do that. So we don't recommend that. But I mean, the idea is that you can still also use it as a biofeedback tool. It's not a peri-fit or it's not an LV. It's not going to light up your phone app and tell you how well you're contracting. But
Right.
for those of you who have sort of like that mixed amount of, there is some overactivity, but we do also want you to like do some strength exercises. It's really great for that, because if your pelvic floor therapist has said, look, you have a great quality of contraction, right? We're getting the lift, we're getting the squeeze. I like what you're doing there. You just need to go away and actually do more of it.
Yeah.
You can contract, like having anything inserted and having that biofeedback to know that you're squeezing something is good. But the only people who, I mean, we do also say if your birth provider has said that you cannot have penetrative intercourse during your pregnancy, then absolutely not. Right. So nothing is being inserted at that point. So, but usually we have that warning on the packaging and everything else. So, or in our instruction booklet. So, but that's the only, and then even I will add, we have a nickel free version. So
Okay.
that's something that some people do have a nickel allergy. There is a small percentage, I believe it's under 10% in ours, in the surgical grade stainless steel. Nickel helps with being rust proof, right? So that's why it's usually put in surgical grade stainless steel, is for the rust. The
Mhm.
more nickel we take out, again, you'd have to put it in acid. It's not going to rust.
Yeah, yeah, yeah.
But we do have one that's under, I believe, 0.5% nickel. And that's something that if you knew of a known allergy, we do have some that we can have made.
Okay.
Yeah,
Good to
good to
know.
know.
Yeah, really good to know. Is there anything else that you wanted to mention about the Kegel Release Curve?
It's great. We want to get it into more mainstream. I mean, we have, there's a couple of articles that we're starting to get PR on, which is great. And I think that it's more beneficial. I really want to get over I mean, we got a long way to go, I know, but I
Uh-huh.
want to get over the stigmatized hump of how we look after our pelvic floor. It is not just a sexual
Yeah.
functional item that we have on our body. It actually serves so much more of a purpose for everyday life, and it's very underestimated.
Yes.
And we have no problem sticking our fingers into our mouths and taking a look at our teeth when we think we got a cavity. Well, we got to sometimes stick our fingers in down there and look after that area. And it's coming. Like I think we're making, I mean, we're trending, Angelique. This is great, right? Like pelvic floor therapy, we're trending.
I agree. And I've definitely seen a massive shift from my early days in pelvic health. I mean, even 10 years ago,
Yeah, you were a super early adopter.
it wasn't known at all.
No,
Like literally,
no.
there were a handful of people, at least in Toronto, that were doing this sort of thing. But
Yeah,
I think now it's a little bit more mainstream, and as a result, people are open to talking about it a little bit more. And
yeah,
it really should just be a common, like normal conversation that you have with
yeah,
friends, colleagues, kids, whoever, right?
yeah,
And
yeah,
hopefully one day your kids or
yeah,
everybody's kids out there will be open to seeing a pelvic physio. It's going to be automatic, or
yeah,
we'll know what a wand is and not
yeah,
have to look it up. And
yeah.
it really should be that way, just like everyone knows what a toothbrush is. So
Absolutely. And I mean, I think that that's really important. I mean, my daughter knows she has a vulva and she has a vagina. She's 4.
yeah,
And yeah, seeing a pelvic physio, I sort of, I sort of say that I think if you're having sex, you should see a pelvic physio, and you don't have to have problems. Again, we'll relate it back to our teeth. You don't see the dentist because you have a cavity. You see the dentist preventatively every 6 months for a
Yeah.
reason. It's an completely empowering experience.
Yeah.
And for me as well, to tell a woman like, yes, you have a fantastic contraction. This is great, and it's 22-year-olds come in and I'm like, give me your best pelvic floor contraction. And I'm like, all right, we got some work to do. And then I've had a 65-year-old woman come in who I fully judged. I thought we ain't going to see much here.
Yeah.
And she damn near clamped my fingers off. Right. So it's not an age thing. And I think that that's also another education point for women to know is that just because you're young doesn't mean it works.
Yeah.
So it's better to get in and really understand how to use your pelvic floor, have that voluntary ability. I mean, if you're not peeing your pants, you probably have a pretty functional, but having the voluntary control over it is only going to help. We assume that we can do a squat until we can't.
Right.
And then you do one, you see yourself in the mirror and your form is like, right? So, yeah.
No, awesome. So, I'm going to switch gears a little bit here. I'm more kind of talking about it now, but I know that, just generally in the pelvic health world, we're sort of talking about what we'd like to see, and it's already starting to change. But is there anything else that you would like to see happen sort of in the world of pelvic health and women's health over the next 5, 10, 15 years?
I mean, ultimately, will speak specifically to Canada and even Ontario is I would love to see. I mean, this was an interesting piece. And maybe this is like, I was going to actually ask another pelvic physio this, but in Ontario, you get OHIP physio if you have an overnight stay in the hospital.
Right.
So there's a lot of women who have an overnight stay in the hospital after pregnancy. So I would love to see OBGYNs writing that script and having more pelvic physios actually fall under OHIP or having that ability, because I mean, I understand what our rates are for physio at this point, and I understand that we are underserving a large community of women who do not have extended healthcare coverage, who cannot afford our rates. And a lot of education, I think, can be done even with virtual to sort of have these women at least be educated. So I'd love to see a little bit more OHIP physio for the community, or even have programs that, I mean, I don't know if you remember what your prenatal classes were. Like, why wasn't pelvic floor covered then? And that was 6 years ago for me.
Right.
6 years ago, and pelvic floor was not touched on once.
Yeah. Huge gap.
Right. Even to have women be told that like you push with your pelvic floor.
Yeah. And this is why I really am so passionate about doing this and actually speaking openly about pelvic health and pelvic products that can help people, because sometimes it's just out of reach, whether it be financially or there's just that lack of education, that gap between pregnancy and postpartum, and primary health practitioners, OBs, midwives. I think it's getting better and better every day.
Yes.
Absolutely. But
yeah,
it would really be nice to see that just as a streamlined process. I think in some other parts of the world, France, it's
France.
It goes back to the French.
Always. Yeah. No, they understand.
It out, right?
Yeah.
So that would be great.
So I mean, that's where I'd like to see a couple of changes, at least on the Canadian front, Ontario specifically. But I mean, what we're seeing now is a lot of pop-up educational programs that you can sort of pay, and I'd love to see that at the hospital level. Midwife centers, doula centers, birth centers, understanding, even I think there's a couple of great programs that are teaching women how to push properly for the first time ever, even though we have evidence-based research to say that we've been pushing wrong for 10 years.
Right.
And yet we're still getting women in and telling them to breath hold. And hell, I fully breath held. I think my eye almost popped right out. But I mean, there's a time and place, and it's multifactorial, and I understand that. But you know, I think we know a lot now. We just have to disseminate that information to the masses as much as we can, which we're doing.
Slowly but surely.
Yeah.
Awesome. Okay, Kate,
So,
I want to ask you one more question before I let you
okay.
go. 'Cause I know you're
Yeah.
a busy lady, so I don't want to keep you too long. But I just like to ask everybody that I chat with, as we mentioned today, the wand can be used proactively, but it can also be used for specific purpose and specific recovery or preparation.
Mhm.
So for you, what would you say is your favorite self-care activity? Because I think it is really important that we all have strategies, especially in a pandemic, but
Yeah.
even outside of a pandemic, self-care is really
Yeah.
important. So
Yeah.
what is it that you love for self-care?
So I've been trying, and I think that it actually sometimes bugs me, but on my Apple Watch, you know how it tells you to breathe?
Yes.
Almost like 10 out of the 12 times during the day where it tells me to do that, I'm like, ugh, turn it off. But I'm really making consistent effort to do it 4 or 5 times a day, because even for I'll say for my pelvic floor, um, pelvic floor being overactive too does not help with constipation. Stress doesn't help with constipation. So down regulating all of these things, and breathing we do underestimate its power. And that's why, as much as I created a perineal or a wand that does perineal massage, I am not just about the physical.
Yeah.
There is a much larger component here when we talk about our central nervous system, and incorporating your breathing into any of these things is important. So my self-care is like listening to my freaking Apple Watch when it tells me to breathe. And I've been trying a
Yeah.
lot.
Baby steps, baby steps. But it's
Yes.
true. We cannot underestimate the importance of breathing and
Hmm.
proper breathing.
Yeah.
Many
Yeah.
people, especially if you're stressed and in fight or flight, it's all from
Yeah.
up here, right?
Yeah.
It's pretty
Exactly.
important. But yeah, breathing's so important.
Yeah. So that's my self-care for at least the next month, and then I'll move on to something else, I'm sure.
Well, thank you so much for sharing. I
No
mean,
worries. Thanks.
personal stories, but also sharing this amazing product and just some tips and tricks as far as how to use it and exactly what it does.
Okay.
So
Yes,
thank
no, thank you for having me. It's always great to collaborate with other Toronto pelvic physios,
you.
especially like yourself. Like, you were on the forefront of the frontier here in Toronto. So,
Yeah, so thanks for being here. And for anybody that wants to learn more about the KR curve, just head over to our website, pelvichealthhub.com, and there's more information there. So, Kate, have a wonderful day, and we'll chat soon.